Good morning, everyone. Good morning. I am Jennifer Fitzgerald, Mayor of the City of Fullerton, and I want to welcome you to this week's virtual town hall meeting. I want to welcome our Fire Chief, Adam Lozier, as today we're going to talk about something that I know is of the utmost importance to everyone who lives and works and is traveling through Fullerton. Emergency response and fire service. But before we get started with that, I want to go ahead and give you some updates from the city on our COVID response and also some actions and deliberations that the City Council had this week. We here in Fullerton continue to do everything we can to support our residents and businesses during the COVID crisis that we're in. I want to encourage everyone when you're out in public to please wear a mask, practice proper physical distancing, and just make sure, of course, that you're washing your hands and doing all of those great hygiene practices that we know stop the spread of COVID. I mean, honestly, if you're like me, wearing a mask is inconvenient, but it's a small price to pay to keep people safe. So as you are going in and out of businesses and enjoying Fullerton, I hope you'll be able to wear your mask. I recently did a PSA, a public service announcement for our businesses to help them understand what things they need to have in place in order to keep their business running during this time. I know with the governor's pullback on some of the businesses that have been open, on how they operate, there are a lot of questions. And so I want to encourage you, if you're a business and you have questions about if and how you can operate right now, go to the city's website at cityoffullerton.com. There's a bar right up at the top that talks about COVID response, and you can get in touch with people to get your questions answered there. And then also I want to let you know that for those of you with dogs who need to get those dogs out to the dog park, our Pooch Park is back open and volunteers are needed to help with the Pooch Park operations. So if you're interested, you can email poochpark411@gmail.com. Again, if you want to volunteer to help with the operations for our Pooch Park, you can email poochpark411@gmail.com. Also, the city has launched a new program called Feed Fullerton. It's a city-run program that connects low-income households with nutritious meals from Fullerton's local restaurants. It was developed as a community-based emergency feeding program created specifically in response to the COVID-19 pandemic. And the goal of this program is to bring healthy and nutritious meals to residents in need. More information on the program is available at this website, www.fullertoncommunitycenter.com/feedfullerton. And I'll ask our staff if they would just put the information about the websites, both for Pooch Park and for the community center, up on our Facebook page today. I also want to let you know that this past week, the City Council met, and I want to thank my colleagues, Mayor Pro Tem Jan Flory, Council members Bruce Whitaker, Ahmad Zara, and Jesus Silva for all the work that they've joined me in doing during this COVID pandemic this year. And we, even in a pandemic, there's still a lot of work, regular work that needs to be done at the city. And we started to take care of some of that work this past week. I know it's inconvenient. It's inconvenient to have to figure out how the city council meetings are functioning during the pandemic, and I appreciate your patience. This city is doing its best to make sure that we maintain engagement. and transparency, the ability for people to participate. And so we are still meeting in person with face masks, properly physically distanced. You can participate in city council meetings via email and online. You can also participate live and in person. So at this last city council meeting, the council continued its discussion on short-term rentals here in Fullerton. And we had a long discussion about it. Eventually, the item was continued for further discussion to the first meeting that we have in September. And then also the council made the decision to place on the ballot this November whether or not to ban safe and sane fireworks. So you'll see that on your ballot and you'll be able to decide that issue. We've had fireworks here in Fullerton we've had safe and sane fireworks here in Fullerton for the past 8 years. And so that question will once again be on the ballot in November. Okay, so let's get to our main topic today. As I mentioned earlier, I'm joined today by our Fullerton Brea Fire Chief, Adam Lozier. And Adam became our city's fire chief in 2018 in December. He's been with the department though for 18 years. He formerly served as the deputy chief of operations for the Brea Fullerton fire departments. And he has served in that capacity since 2015. He's a member of our consolidated command staff. You may know that Fullerton and Brea merged our fire command staff some time ago. And so Adam serves as the fire chief for both cities. Together, both departments responded to 20,000 calls in 2017, and we'll talk more about how many calls in the past year that they've responded to. And Adam's education was at the University of Hawaii. He has a bachelor's degree in political science, and he's a California State Chief. He is California State Chief Officer qualified. So maybe Adam, you can tell us what that is and introduce our Fullerton Brea Fire Department and tell us what our department is like.
Thank you, Mayor Fitzgerald, for having me on. And I guess right before I get into that, I just want to tag into your PSA on COVID-19. And from the fire department perspective, everything that the mayor mentioned about keeping yourself and your family safe is incredibly important. And it's important for you as family and as residents and business owners. But it also keeps your first responders safe. So when your police or your fire respond to an emergency, we are wearing the proper protective equipment, and we're doing that to keep not only you safe, but to keep us safe. Just because COVID is going on doesn't mean that other emergencies aren't still occurring. And so we still want to maintain our workforce to continue to serve. So wearing the masks, as the mayor said, can be inconvenient, but it's a very good step to keep everybody who is in contact safe. So with that being said,
and Adam, could I interrupt you for just a minute, because I love that segue as you talk about the preparations that you've made with your department. Maybe before we go into the overall department and emergency response, will you just further your thoughts there on exactly how you respond to calls right now during the pandemic? Is there, can people feel confident that, as you said, your folks are in personal protective gear? Do you ask qualifying questions ahead of time to know if the person possibly has COVID who you're going to assist?
No, that's a great question. So upon dispatch, when someone calls for a medical emergency, our dispatchers do ask qualifying questions. And based upon the answers they get from the calling party, we'll pass it on to the first responders. And then our personnel will don advanced PPE or personal protective equipment. So when they get on scene and of somebody that has a possibility of either a positive test for COVID or signs and symptoms related to that, we only send one member in at a time, and that's just to have them go in, bird dog, or ask questions and determine what is needed for that particular patient, and if it's safe to bring in the rest of the crew to assist. So the idea is to limit the exposure, obviously to treat the patient appropriately, and get them to the appropriate facility. So 100% the public should feel safe that the first responders that are coming in to treat them are being protected. The transportation to the appropriate hospital, those people are also are protected. And then the hospitals too. The hospitals have taken incredible steps and measures to make their facility safe, isolated where it needs to be isolated. Because like I mentioned, COVID is one piece of the puzzle of emergency response, but the heart attacks, the strokes, the diabetic emergencies, respiratory emergencies, anything that is a true medical emergency, those obviously still continue. And we do want the public to feel safe and confident that that system is clean and is there to only improve your circumstance and not to hinder it or cause it to be worse.
Good. Thanks so much for that. Okay, let's go and let's step back, take a 10,000 foot level, give us a 10,000 foot level picture of how our residents and businesses are served by our police department.
So for the city of Fullerton, we, for the fire department, we have 6 fire stations. They're located throughout our city geographically and specifically to meet the needs of the community. We have 6 pieces of equipment that respond out of those 6 stations. 4 fire engines, which are the shorter ones, that have 4 people on them, 2 of which are paramedics. And we have the long ladder truck, and that has the person that drives in the back. That also has 4 people on them. That they do not carry paramedics. They are EMT or basic life support only. On each of those pieces of equipment, we have a captain who is a supervisor for that crew, an engineer who's responsible to drive and pump that apparatus, and then we have 2 firefighters. The firefighters act as the task keepers, so they carry out what is directed by the captain. So we have a separate transport piece for our medical emergencies. We have a public-private partnership through Care Ambulance. So when the paramedics arrive on the fire engines and we determine that a patient needs to be transported to the local hospital, the paramedics get into the transport ambulance and transport them up to the appropriate facility.
Adam, are those 2 firefighters also paramedics?
On the fire engines, they are, yes.
Okay.
So on the truck company, they are not. The truck company is a specialized piece of equipment. Obviously, we only have 1 of those, and they serve a couple purposes. They work in coordination for ventilation for fires. They have the jaws of life. They do a lot of the technical rescues, so cars into buildings, people that may go off our local trails. They are more a very specific company that supports and works in coordination with the fire engines on different emergencies.
And how many fire engine groups do we have?
We currently have 5. So our stations 1 through 5 have the fire engines. Our station 6 up in our northwest part of the city has our ladder truck.
Great. Will you talk a little bit about how the department has grown or changed in its ability to serve Fullerton as Fullerton's population has grown?
So yes, the population is grown, it's evolved, it's changing. We obviously have a lot of development that is going on within the city. Currently over in the Kimberly-Clark area, that is going to be a development. We have large
commercial development.
Commercial development, correct.
Mm-hmm.
We also have the residential development that is going on, and then our Coyote Hills that will eventually be developed as well. So with that, we have the fire department tries to stay ahead of the trends as much as possible and to keep up with that and be proactive. In 2018, we made a deployment change to address some of this, and that was we took an engine company, and we took an engine company out of service, and we did reduce our numbers by 3 firefighters. We peppered out the remaining crew members to our stations 3 and stations 4 to make them four personnel total. The benefit to that now took our resources out of the 6 stations, made 5 of them paramedic advanced life support stations, and gave them the ability to run stable, to be a 2-for-1 resource. So for example, when we have a patient that has chest pain, that engine can arrive on scene, they can treat the patient, and if that patient is stable after being treated, 1 paramedic can transport that patient in an ambulance up to the hospital. The remaining 3 people, the captain, the engineer, and another paramedic, go back into service on the fire engine, ready to respond to that same first due district. So by that action, that has helped to decrease our response times within that area, and be more available for whatever type of call may come about. Now, the downside to that was we were only able to do it with 5 of our 6 areas. So equity within our city is important. Our truck company, which I mentioned, is specialized, is more of an addition to how we want to serve our city. So,
and is it right? Is my understanding correct that truck company is at Station 6 because Station 6 is closest to a lot of the undeveloped wild land, basically, that we have?
Not really. It's up there mostly because it only can fit in a couple areas. So our downtown area, one would think, well, just keep it down in your downtown area and move the engine up to Station 6. Okay. Unfortunately, our downtown area is our busiest section of the city. They run about 4,000 calls a year. And for a large fire truck to do that at the cost of that fire truck does not make sense. So we moved it up there. So it has, it can physically fit inside of a building. And 2, it's our, we have less calls up there for it to respond. So it's the best, I guess, of the best of the.
So it's less wear and tear on the truck.
Correct.
And physically, you can't fit it in some of our fire stations because our fire stations are too old.
Correct. They're made for smaller fire engines, and if you come by Station 1 on Lemon and Commonwealth, you can see our 1962 Crown, which served at the Station 5, and you can see how the difference in the sizes of just the fire engines. And those of you that are on, if you have a Ford F-250 pickup truck, well, the length of that is fairly similar to what the fire engines used to be in the 60s. And that's most of our fire stations were built in the mid to late 60s and accommodated those fire engines appropriately. But with the size differences taking on more, that space has become more of a challenge. And in the case of trying to move our units around, we're relegated to only, in this case, just 2 stations. Now that truck used to be out of our Station 1. It used to be our Engine 1 and our Truck 1. And that was probably that's our best deployment there. As far as for the truck, because it allows it to be more centrally located to get to what it needs to get to. Our freeways, our downtown area, which a lot of it is built before the 30s. So there's a lot of pre 30 construction there, and so that's the objective, is to try to get it back downtown so it can serve generally the entire city appropriately.
I see. Okay. And I do want to talk more a little later about the resources that we have with our fire department. But I want to talk a little bit about emergency medical services and how they're delivered here in town. And also, if you could talk about the ambulance subscription program that we have.
So when any firefighter that we hire with the city of Fullerton, one requirement is that they have to be an EMT, which is a basic life support technician. So every firefighter you see has that skill set. In addition, we have members that have been trained in advanced life support. So they go through a testing process amongst their peers within the fire department. They have to be off of their 1 year of probation. And the reason why they have to be off that 1 year of probation is we want them to get the on-the-job experience riding with the other paramedics, going through that skill set and thought process, the critical thinking thought process, to best prepare them to go to school. We send them to a 6-month intensive program through Saddleback College. They come out and we activate them within our system. So they deliver the advanced life support within the city of Fullerton. And that occurred back in 1974, where we integrated paramedicine with fire suppression. And the idea of that was the rolling toolbox, the rolling Swiss Army knife. And so whether it's a heart attack, it's a fire, it's a car accident, whatever the case may be, that unit, that fire engine, can take those skills, both physical and cognitive, and go and solve that problem. We understand everybody's problems have different levels, so what might be an emergency for one person may not be for somebody else. But whatever the case may be, our job is to come in there and to solve that. And sometimes that's with fire, sometimes it's in coordination with our police department.
I think some people might be interested in the ambulance subscription program. Could you talk about that?
Sure. So our ambulance subscription program is open May through July 1st. It's open year round, but it's technically flown out and advertised through those 2 months. And basically what that allows you to do is that for one household, for the dollar amount of $42, your household or your address can be subscribed to this service. And what that does, that allows, if you happen to call and utilize our service for either a basic service or an advanced service, that basically waives that assessment fee for you or anybody else that is in your household. We currently have about 15,000 residents that subscribe to our subscription program. And I would highly recommend those of you that are listening to get on our website, the fire department website, and look into that. You can also call our administration at 738-6500 if you have further questions about our paramedic subscription program. But a very good deal, I guess you can say, for any members in your household. Thank you for bringing that up.
Yeah, good. No, I'm glad to talk about that. I think it's something that a lot of people don't know about, but if they did, they would utilize it. So thank you for that.
Sorry to interrupt you. It may be, if those of you listening, if you look on your water bill, either this one that's coming out this month or just your past, there will also be information on their contact information as well.
Good. Okay, thanks. We have all at the city of Fullerton had to do more with fewer resources in the past many years, and that includes decreasing our permanent employees for the city by over 100 positions. It includes creative solutions to how we deliver services, like the fire command merger between Fullerton and Brea that I mentioned earlier, which saves our city an annual $750,000 through efficiencies that program creates. We have had to run a pretty high employee vacancy rate, even above those 100 permanent positions that we've cut, so that we operate and have for the past few years in this city at almost a 20% vacancy rate. And unfortunately, that affects services all across the city's scope of work. Chief, could you talk about how that reality has affected your department, and how you have managed to still provide the fantastic service that you all do for so much less?
Yeah, and that has been a challenge. We take a lot of an incredible amount of pride in serving the city of Fullerton, and that comes from our hiring process, which is very rigorous, and our training initial academy that our members facilitate, and then of course their probationary year. It is all with the intent of providing the city with the best of the best, and instilling that pride that comes along with it. So we do that. The city of Fullerton, as a firefighter, provides a diverse call volume, and for people that are trying to get into the fire service, that is a big attraction. Being able to do a lot of different things is huge, and so we have gotten and continue to get great people. Unfortunately, we've had to deal with the loss of membership to other cities for various reasons, and when we have those vacancies, our job is to respond to any place in the city 24/7, 365, and to provide you that service for whatever it may be. And that may mean that we may be down on personnel. And with that staffing, that constant staffing that we maintain, that becomes challenging, and trying to keep our that training of new people becomes a huge burden on the department. No different than some of the other departments where we're doing 2 or 3 academies a year, because we're pushing out people to the field, but we're losing people out the back end. And
so talk about that, Chief. What are your how easy is it for you to recruit new firefighters? How easy is it for you to retain those qualified firefighters?
The ease by which to recruit is good because they're hungry. Everybody's hungry. They want to get a job. The ability to retain people once firefighters are hired with the city becomes challenging, as they are balancing out what's best for their families, and it comes down to stability of both the city and paying benefits. So we provide, as a department, we do our best to provide the environment, the safety gear, the equipment, whatever we can to keep them here. But at the end of the day, we do lose people to surrounding agencies for dollars and cents. And I don't believe members want to go there. They love where they started. They want to remain here. But that's just a reality of our service, which I believe is no different than any other service that's out there. And for me as the fire chief, I don't want anybody to leave my city, my department. I want them to stay here. I want them to serve here for 30 years and be an integrated part of our community. So I
Okay.
need some assistance with that.
Yeah, we talked earlier about the 6 fire stations, the where all the resources, the ladder truck as opposed the truck company as opposed to the engine companies. Talk about Fullerton in terms of a comparable city like the city of Orange. If you could, I think sometimes we don't understand what kind of resources we have compared to other similarly sized cities, and maybe you can just tell us how we do in that regard.
So the city of Orange, comparable in size, both in population and in land size, acreage, um, and where we different primarily is our revenues that come in. So the Orange Fire Department does have considerable more resources, and for them, that's what they've been able to do. For us, we are doing the best with what we have, and I do believe we deliver an outstanding service to our members. Um, and what we've had an issue with is just trying to be proactive with the growth of our own city, which is, like we mentioned in the beginning, it is growing, and to provide an equal service amongst the city is my overall objective. I want every citizen to be able to have the same access to advanced life support paramedic services. And I want our truck company to be able to serve and be able to respond to any parts of the city from a centrally located central location. Um, and so those are the challenges right now that a like city such as Orange doesn't have that challenge per se. And so, yeah.
Yeah, and so you talk about, I mean, this is all for the purpose of quick response in emergency. And I am constantly impressed with how much service your department provides with the resources that you're given that are available to you. So will you talk about what are the legally required response times? Where are we at in our response time to emergencies?
No, great question. So I know I didn't say it in the beginning, but just last year we responded to 13,272 total calls, 334 fires, and 10,796 emergency medical calls. There were some hazmat calls and other calls that were peppered into that. Compared to last year, we ran 3.5% more than last year. And 10 years ago, in 2010, which I can't believe has been 10 years already, we ran 10,262 calls. So 10,200 calls and 10 years ago compared to 13,200 10 years later. That's a large jump. So with what you said, Mayor, a 3,000 call increase with no real change in our number of resources has been challenging. Response times, those are critical. And why are they important? For the emergency medical piece, they're critical because time is heart and brain tissue. American Heart Association recommends getting BLS or basic life support on scene of a patient within 4 minutes. And so we strive within the fire department based upon a national standard to get our personnel there within 5 minutes. So it is a minute of getting their gear on, getting on the engine and responding to the patient, and getting there and providing that service. Now, on the fire side, 8 minutes is what we shoot to get all of our personnel there. And that is a full response to a structure fire. Now, why is that important? Well, that has similar importance in that time is possibly rescue, it's survivability, it's property preservation, and it's the safety of our first responders that are going in there. Longer that fire goes unchecked, the likelihood of somebody not surviving, the likelihood of that house or that property being more damaged, and the likelihood of when our people go inside, they're going to have more extreme conditions to contend with. So for our, just to walk people through kind of how a call comes down, which I think is important, and it kind of gets misconstrued. So if you as a resident, you have a you have some sort of emergency, you call 911. The local police department, in this case, the Fullerton Police Department, will answer the phone and they will ask 911, what's your emergency? Is this police, fire, or medical related? If it is fire or medical related, they will transfer that call to our dispatch center, Metronet Dispatch. That's located in Anaheim, and it's a joint powers agreement between several cities in Orange County that we all pay into to have a robust dispatch center for fire and emergency related calls. They handle about 1.5 million people and about a little over 200 miles of geographic location for the cities that participate. That dispatcher from Metronet will take on the information. They'll dispatch the closest unit, and the closest units. So all of our fire engines have mechanisms on there that relay up to a satellite, basically showing their GPS location at any given time. So based upon the calling party and the location of that fire engine, Metronet will dispatch that unit to get the closest unit there, whether it is a medical call or a fire call. That process, and then by the time our units get on scene, that total process is what I mentioned is our goal is 5 minutes. And traditionally in the last several years, we have met that, and we've been able to do different things like we did in 2018 with our redeployment to aid in that. But we are trying to make sure that that is equal amongst the city. Something else I was going to mention about that.
Well, the getting to, like you said, for basic life support, American Heart Association recommends a 4-minute response time. What are things that we can do proactively to decrease the response time here in Fullerton?
The best ways to decrease our response time are to just increase our resources, and that's the rolling stock or fire apparatus, and then the number of personnel that are on that apparatus and their training. So
are we still having to buy used fire equipment? And I think we've been saving up for a new ladder truck for some time.
Correct. So that is a huge challenge. Fire apparatus is probably the most expensive apparatus we have as part of a city. We do get a long life out of it. Our fire engines have a 15-year frontline service and a 5-year reserve service. Currently, we had a reserve or a backup ladder truck. It was involved in an accident. A drunk driver hit it while it was on a call. Luckily, both the driver and none of our personnel were injured, but it did demolish our truck. So now we have one ladder truck that is 18 years old. It is getting ready to it's supposed to be going into reserve status, and we are struggling to find ways to make that purchase. Unfortunately, with those purchases for fire engines or ladder trucks, the build time is at least a year out. And so we are looking right now to find ways to make a purchase for a new ladder truck. As of right now, for example, today, that 18-year-old ladder truck had a major hydraulic leak. And so the long 100-foot aerial is inoperable. So as far as taking care of our own city, that truck still has the tools on it, but we have to have another unit from another city respond in addition to our own ladder truck So we have aerial capabilities in case we need to go above grade higher than 35 feet. And that's just one issue. And right now we don't have anything to back it up. And we should always have something to back up our apparatus. So that is one of our big challenges that we're immediately facing.
And you talked about the number of calls from 10,000 calls in 2010 to over 13,000 calls in this last year. How does that equate with, or how does that compare with other cities and their call levels and our level of resources?
Just as our number of calls have gone up, so have our neighbors, our other fire departments. They have also gone up. But what I've noticed in my position and talking to my peers, that there has been they've found different ways to increase either their rolling stock, their number of resources, or their personnel to begin to accommodate for that, in conjunction with the growth or the proposed growth. And that, to me, if we're looking out long term, that is the best way to grow with the city, to maintain services, and to take, instead of more of a drastic, we have to do everything right now. There's more of a planned out approach, forecasted approach, that takes more of a strategic level, looking at how we need to deliver service currently and how we need to deliver it in 5 years, 10 years, 15 years down the road, so that financially, of course, we can plan for that based upon current trends, development, and needs to the community.
And as you look out long-term, Chief, for how our department is going to need to change to better serve our growing and changing population, what kinds of things are you looking at in how you deliver service? From where do you deliver service? Do we need more stations? Do we need smaller, bigger stations? Do they need to move around the city? What are some of your plans and your vision?
Well, definitely, as I mentioned before, the top priority is to provide that equity throughout the city for advanced life support. I do believe that the 2-for-1 resource for our paramedics is a very important resource for us, to not only grow but also to maintain and reduce response times. Our stations.
And wait, let's pause there. Talk again, because I just want to emphasize this point. You mentioned the 2-for-1. So just explain again what that means.
So that is where, if we have on each paramedic unit, we have 4 people. 2 of those are paramedics. If we have a stable paramedic call, 1 paramedic can go off of that fire engine and transport that patient to the hospital. The other 3 members can go back in service on the fire engine and take care of their first due area.
Rather than taking that whole engine out of service.
Correct.
Mm-hmm.
So that in and of itself, if I had that resource out at Station 6 and I had my truck down at Station 1, that would be an incredible increase to our service level and would definitely decrease our response times. And along with that is our aging infrastructure, much like some of the rest of the city, as we've had to defer maintenance to many of our stations. We're trying to do the best we can with what we have, but the fact of the matter is the structures need help. They have to expand to accommodate what we're trying to house, and so that becomes a challenge.
Even as the ADA requirements have changed, I've been through many of our stations, and so the way that you've had to try to modify current stations to comply with current law, it's tough. You all end up. I've always been impressed that you all also end up being carpenters and plumbers and interior designers
Right. Yes. Yeah.
and cooks. Let's not forget
And
cooks.
cooks. No, we do. We have, we have two females who are captains on our fire department, and as far as ADA and gender compliance, that is something I don't want to say newer to the fire department because it's not, but it is something we have to be cognizant of, and we have the responsibility to make sure that our facilities meet those needs as we try to make sure that our workforce is representative of our community. And so that's another challenge that we need to write. And you're right. The members, the firefighters, they are jacks of all trades.
And Janes.
Jacks and Janes of all trades, and some of them, they bring a lot of different talents to the table, and that's where we've been able to improve upon things by those skills that the members bring, and that's fantastic. We do have a great working relationship with the other departments, so we do try to help one another out to move forward. But one of the other pieces I wanted to mention is just the ability to strategically plan and implement or integrate technology into our forward progress. So a lot of the stuff that we talk about or we need, those need to be based off of statistics, and a lot of that is technology that we are behind on. And one example of that is the mechanisms by the program by which we monitor our reporting system, both for our fire prevention and for our line personnel. And those simple programs help give us the information, good information in, good decisions out. And by being able to upgrade those things and put together a strategic plan, that helps guide the ship. And that's definitely something that I want to put together so that the mayor, the rest of council, the citizens understand based upon the need and circumstances around us, both currently and forecasted, know where the fire department's going in particular and the reasonings for that. So that's another big deal.
Yeah. I know we're nearing the close of our time, but something that, of course, we all are thankful for and are mindful of is that fire and EMS are dangerous occupations. Most of us run from danger, and you all run smack dab into danger to help others. So how do you evaluate and mitigate those safety risks associated with providing these essential services?
First and foremost, it just comes from training. So we have a fantastic command staff that provides that training, and secondarily, it's the equipment that the firefighters need to wear. So being able to have a program that their turnouts cycle out based upon a national standard to help reduce any type of the cancer causing agents that already are an impact to the profession, but any way we can act to reduce that exposure is important. Also in the case of medical emergencies, what I mentioned in the very beginning as far as taking those PPE precautions, educating our workforce so they know what they're getting into, what are the limits that they can go into. Because my objective is to make sure that they can respond safely and be confident in delivering the service so they don't have to worry about that. They worry about the patient. And that's my responsibility as the fire chief, is to make sure they have the training, the equipment, the apparatus to get to the call safely, deliver the service, and worry about just dealing with the problem that's in front of them and not necessarily their own safety, because that's taken into account.
I've really learned a lot from my visits with you and your command staff and your firefighters. at your headquarters, getting to observe the fire academy, getting to see firsthand, and even me getting to try some of the try to do some of the procedures, like the jaws of life,
You climbed the ladder?
apparatus that what, I'm sorry?
You climbed the ladder?
And
The
I
stairwell?
climbed the ladder. Yes, absolutely. And I think it would be really instructive for more of our citizens to get to see firsthand as much of that as possible. Do you have any plans to open up more of your operations like that to members of the public to get a firsthand glance at what you do?
We do, and unfortunately with the COVID thing, it's put a little bit of a hamper on that. We traditionally would have an open house on an annual basis, and every other year to that, we would do a pancake breakfast to really show the community and expose them to what we do. Um, you know, Traditionally, the fire department doesn't do a whole lot. We don't, we're not probably the best to market ourselves. They're very humble. They don't like to talk about themselves. But we also realize that it's important for the citizens to know who's in their backyard, who's serving them, who are the people that are in their area. And so having that open door, inviting people to check out the fire engines, to see how we live, to do a ride along. Those are all absolutely fantastic ways for the citizens to gain some perspective on the fire department, and we are all about that. Unfortunately, like everything else, it's on a timeout right now. But as soon as we are able to, we encourage people to come check out their local fire stations, meet their local firefighters, and ask questions and learn about the service that we deliver to you. We're very proud to deliver that service, and continue to serve and answer questions wherever appropriate.
Yeah, that's great. I know I want to respect everybody's time, and I want to give you the opportunity to have any closing remarks that you might have.
Sure. No, I appreciate the time. We did a Citizens Academy via Zoom last week or 2 weeks ago, and that was a great opportunity to kind of explain our department, our fire prevention side, our administrative side, our CERT program, and in the future we hope to do that in person. This would be great to do in person, to where there's more visual side to it. But we are striving. As the fire chief, I'm a customer service representative for the men and women of the fire department. And I do that by looking out at our community and seeing how we can best serve our community, respond to you in the fastest manner possible, and provide you with the personnel who are the most trained, and safely protected members to take care of your situation. So working with the city council, the city manager, the other departments, we're going to continue to try to achieve that, to have an additional unit for the equity amongst our city for advanced life support, to come up with a mechanism to purchase that ladder truck, so that we have both a frontline ladder truck and a backup ladder truck. So it is the city of Fullerton that is serving the city of Fullerton, and we rely on our neighbors when we get in a bind. But it's not who we're leaning on to deliver the service. That's our responsibility, and I take a lot of pride in that, as being someone who's served for 18, almost 19 years with the city of Fullerton. I want to continue that and see that grow, and get that strategy together, so that in 15 years, we're in a place of being proactive, and not necessarily reactive, because I do believe that's the best approach for public safety.
Yeah, I want to thank you so much, Chief Lozier, not only for joining me today, but for the job that you and your men and women do every day, 24 hours a day for this city. I know that as we've talked about here for so many years, we've really demanded that you do more with less. And we all have done that across the spectrum. And you all have continually risen to the challenge of doing that as we've been as creative as possible in creating efficiencies that get more resources to the fire department. I'm mindful of the fact that Fullerton is unique in that they're not only are we so large with a population of over 140,000, but we have a wide swath of undeveloped open space. We have a downtown that is active 24 hours a day. We have issues of homelessness in our neighborhoods that lead to emergency situations. We have a significant aging population that lends to more emergency calls. We have all this, a confluence of challenges that we have to meet to keep our city safe. And you all are great partners with us in trying to do that. And I know I speak for the city, the people of the city of Fullerton when I say how much we appreciate all that you and your men and women do. So thank you again, Chief Lozier, for joining me, and for the members of the public who tuned in today or will watch this on Facebook and our website in the future. I appreciate that you joined us today. I would encourage you, as the chief and I did at the beginning of this town hall, to stay safe and make good decisions to keep not only you and your family members safe, but those around you and those in your community. This pandemic is a huge challenge to us all, but I know that together we'll get through it and be stronger for it. So until we meet again, I wish you peace and health, and I'll look forward to seeing you next time. Thank you.
Thank you.